Welcome back to Emergency Medicine Coach. Today I am giving you the ABG cheat code, a method so simple that you can interpret any ABG in under 15 seconds. And yes, this is just the beginning. I am also dropping a complete ABG masterclass very soon. So subscribe and stay tuned. Step 1. Look at the pH first. Don't look at anything else. See, is it acidosis or alkalosis? Whether the pH is less than 7.35 or pH is more than 7.45. This is your anchor. It tells you the direction of the problem. Step 2. Carbon dioxide status. Yes, now check the PaCO2. If carbon dioxide moves in the opposite direction to pH, it's respiratory. Examples: if the pH is low and the carbon dioxide is high, then it's respiratory acidosis. If the pH is high and carbon dioxide levels are low, then it's respiratory alkalosis. Step 3. Bicarb value. If carbon dioxide didn't explain the pH shift, look at bicarb levels. If bicarb moves in the same direction as pH, it's metabolic. Examples are: if pH is low and bicarb is also low, then it's metabolic acidosis. If pH is high and bicarb is also high, then it's metabolic alkalosis. So here's the whole trick. First, look at the pH. Is it acidosis or alkalosis? Secondly, see whether it is caused by the carbon dioxide levels. And finally, if it is not, see whether it's a bicarb that caused the acidosis or alkalosis. That's it. You have just diagnosed 90% of ABGs with zero memorizing. This is your quick visual diagnosis table. If pH is low and carbon dioxide is high, then it is respiratory acidosis. If pH is low and bicarb is also low, then it's metabolic acidosis. If pH is high and the carbon dioxide levels are low, then it's respiratory alkalosis. If pH is high and the bicarb levels are also high, then it is metabolic alkalosis. Let's do one ABG in real time. If pH is 7.28, yes, it's acidosis. As a second step, look at the carbon dioxide level. Carbon dioxide is 58, so it's high. Yes, it has caused acidosis. So the diagnosis is respiratory acidosis. Time taken around 6 seconds. This cheat code works every single time. If you want to go beyond the basics, delta ratios, compensation rules, high anion gaps versus normal anion gaps, oxygenation, AA gradient, acute versus chronic disorders, and complex mixed disorders, I am releasing a full ABG masterclass video next. Make sure you subscribe so you don't miss it. This is Emergency Medicine Coach, simplifying emergency medicine one cheat code at a time. See you in the masterclass.